And today we are thrilled to have Dr. Raj Dasgupta here with us to talk about his upcoming webinar for the Life and Breath Foundation. And, you know, I want to go through a little bit, Dr. Raj, of your pedigree and your background, because this is something. Let's see here. Dr. Raj completed internal medicine residency at Michigan State, pulmonary critical care fellowship at Columbia. Not bad. Let's see, the training, there was a bunch of awards. We have Resident of the Year, Fellow of the Year, Director's Award Research. He's a professor at Southern Cal right now. And you're quadruple board certified. Now, I read all these things, and then I also watch several videos of yours of the media that you have done. And I can't wrap my head around it. I'd like you to just start off by laying this out. How is it that someone that can be so smart and so brilliant can also come across as an everyman, somebody I feel like I can relate to you, but I don't know how I could.
No, I love these questions. And I think the answer always comes down to, I have the best parents in the entire world. So, you know, I mean, I'll reveal it now to you and everyone that I'm an only child. And so I got the good and bad attention of my mom and dad. And, you know, they did sacrifices for me to be where I am. And I really think that, you know, the quadruple board certified really carries over, not to me and when I apply to jobs, but to my patients. Specifically when we talk about sarcoid patients, because I'll say this once, I'll say it 1,000 times, is that sarcoid affects every single organ in the body. And, you know, I'm sure down the line, you're going to ask me, well, why do lung doctors kind of embrace sarcoid more than any other doctor? And they do, but I really feel it's because I'm grounded in internal medicine, which makes me a better advocate for my patient. Because I think the main thing in any disease state, especially sarcoid, is not, well, hey, how smart is Dr. Raj? I think it comes down to, can he communicate with the other doctors that need to be involved? Does he play well with others? And I really feel that is what sarcoid patients need for their doctor. Will he talk to the eye doctor, the heart doctor, the lung doctor? So when you mention quadruple board certified, it does put a smile on my face. My ego is like through the roof, don't worry. But I really did all this work to help my patients.
And yeah, and again, I just as someone who, you know, I sat in with a doctor for my daughter. She has scoliosis, and I barely understood anything that he said. He couldn't relate one-on-one, and so I greatly appreciate your ability to do so. And that's why we wanted to have you here to talk about this and about sarcoidosis in particular. What is so mysterious about it? Why is this disease so puzzling, and where are we in terms of trying to track it down and really getting a handle on fixing it and, you know, eradicating it possibly?
Oh man, I love multiple questions at one time. I dig it. So number one, when I explain to patients about sarcoid, is that the answer is we don't know what causes sarcoid, because in any disease you're going to ever ask me about is you want to get to the root cause. But what summarizes sarcoid is going to be a quick story, which is, how do most of my patients come to me? They come to me because someone mentioned to them that, you know what, you may have cancer. And it may be metastatic. You may have a horrible infection in your lung, like a tuberculosis or a fungal infection, and they're worried and they're crying and they're calling all their relatives, and they follow their doctors and get the procedures. The next thing you know, a biopsy comes back and they're like, congratulations, it's not cancer. All of a sudden the tears go away for 1 second. And then they're, well, what is it, doctor? It's sarcoid. And all of a sudden that blank look on their face, and I think every patient watching this video is going to know what I mean. What is sarcoid? And then they read about it and they're like, wait a minute, how is this even better than what I was supposed to have? And that's where we come in, and you're mentioning about, you know, it's how you approach the patient. How do you talk to the patient? And it is frustrating. But to summarize in the medical jargon, it is what we call a diagnosis of exclusion, ruling out the cancer, malignancy, the infections, and you're left with an inflammatory disorder that involves something called a granuloma. And you're going to hear this word many, many, many times with sarcoid, is that we have these non-necrotizing granulomas, apologize for the medical jargon, that really affects every organ. And if these inflammatory granulomas are not under control, it can cause some nasty, nasty organ damage. And that's the summary.
So that's what it is. As far as treatments, where are we right now in handling it? And I know that, you know, since, you know, Sean started the Life and Breath Foundation, the the improvements have been so great. I mean, what would have been able maybe to be helped his mom would have been remarkable. But where are we now in terms of that? And what are some of the things that sarcoid patients can look forward to, having treatment to really help it?
Yeah. Well, first off, I know we just saw Sean. He is awesome. That was the first time meeting him, and I could sense good vibes with him. And I wish we had some of these treatments now for his mom. I don't know the whole details of the story, but the answer is this, is that, sarcoid is an orphan disease. What does that mean for people watching? Is that it's rare, but I hate saying that because you have it and you have it, and I'm calling it rare. But because of that, we don't have a lot of research that really focuses on sarcoid. And that's why I always want to be an advocate. And because it's an orphan disease, I want to stand up for the whole David and Goliath story. I want to be the David and stand up for you and let you know that this disease does exist. Fortunately, most people with sarcoid are going to be, the word is asymptomatic. I know we've been hearing a lot about this asymptomatic word with COVID-19 nowadays, but the thing is that they follow me because they need what they call some surveillance, just to make sure it doesn't go anywhere. But there are that percent, and you know who you are, where it will be a very tough course. Usually the course is it exacerbates and it remits, but sometimes it doesn't stop. But my teaching point for your question is going to be the most common organ involved in sarcoid is always the lung, which is why lung doctors take control. The second most common organ, I wonder if someone's going to answer this one, is the skin. But there are three organs I always say that if you have involvement, I need to be aggressive. And that's always going to be the brain, the eye, and the heart. But not everyone needs to get treated. And one last thing is I could carry on forever, it's just my personality, is that the mainstay treatment for sarcoid is something called steroids. And I always say to my patients is that steroids have good and bad. But because of the side effects, and there are plenty when you're on steroids, my patients come with me to sarcoidosis. I try to do the right thing. And sometimes they leave with another diagnosis called steroidosis because of all those side effects. And that's why you need to have a physician that explains the risk and benefits and puts you on the right meds for the most limited amount of time.
So coming up on August 13th, you'll be doing a webinar for the Life and Breath Foundation. And can you tell us a little bit about what you want, the points that you want to get across and things that you want to make sure that those that have sarcoid, what is key for them?
I would say this, is that I realized that before we talk about what the treatments are, the question becomes, do I need to get treated? And I want to start my conversation during that webinar with that emphasize not everyone needs to have therapy. And then when we put you on treatments, because the fact that it is that orphan disease, that we don't have the multitude of studies I wish we had for larger diseases like high blood pressure and high cholesterol. But the therapies that we have are all about risk and benefit. And I want all the patients to know out there is that when a doctor places you on medications, do you know those side effects? What should we be checking? Who else should you be seeing? And if I have a side effect, is that from sarcoid itself or the medication? And like you asked me in the beginning, well, what medications are out there? And there's not enough time in this conversation to talk about that. And I want to give the chance for the patients to hound it in, to ask me what you want to know. And I'll tell you at the best of my ability, what is the best treatment for your sarcoid.
And that's what's so great about this webinar is that patients can ask questions. Therefore, you jump on board, take a part of this. This is such a great opportunity to have one of the renowned experts being here for you to let and as we can see, he'll explain things in a way that you can understand and appreciate, and then your life will probably get a little bit better, which is just, we can't thank you enough for that. Is there anything else I feel I left out in talking about what you want to talk about or where we are with sarcoid?
Oh, you're setting me up for another 20-minute conversation right here. I will say this, is that, April is Sarcoidosis month. The color of sarcoid is purple. I'm going to be wearing my purple with pride almost every month. I just want every patient to know who watches this is that you're not alone. And please tune into this webinar. It's going to be amazing. And I hope one day, in a good way, to meet each and every one of you.
Now, also one last question for you, Dr. Raj.
Yes.
So are we going to have football, the Rams and the Chargers? Are they going to play in LA this fall? What's going on?
My poor LA teams are getting moved everywhere, and it's hard to, put your heart and soul into one of these teams. When I was growing up, I loved the Rams, and maybe you remember Eric Dickerson? I
Sure.
gotta tell you, I had his poster on my wall. So, my heart goes out to the Rams, and finally, if we could finally get COVID under control, because I'm a positive person, we will eventually. You could count me in to go watch one of those Ram games.
That's excellent. I look forward. You know what? Maybe we can take one in together. You come to Baltimore, I'll take care of you with the Ravens, okay?
Oh, I'm going to take you up on that. No questions asked.
Absolutely. That's great. Dr. Raj Dasgupta, thank you so much for your time today. We greatly appreciate it. Can't wait for your webinar on the 13th.